Hi there, Jen Russell here. Today I'm going to be working on a drill. I'm just going to be looking at trying to get a little bit more movement in the lower ribs area, the thoracic, lower thoracic area of the spine, which, if you can believe it, is meant to be the most mobile part of our spine. And I can't tell you how many people I've worked with who, when I've tried to work on getting, whether it's getting breath, lateral movement of the rib cage, moving out of what we call a rib flare, which is here, and trying to work on starting to get coordination and rotation in this part of the spine, it often feels like an impossible task. So if you try this, and this drill I'm going to go through today can be a great assessment tool. If it feels literally impossible to get any rotation in this part of the spine without hyperextending your neck, going into an anterior pelvic tilt, or kind of just losing and super wobbly side to side, I would highly recommend you go back and try some of the other things that I've done in other videos, the supine 90-90 breathing, the quadruped hands and knees. You might find that working on those drills before you come to this one might help you get a little bit better at this one when you try it again. But for now, the positioning cues I've talked about in all the other videos: long neck, chin back, chest wide, these lower ribs slightly pulled down, and hips relatively even. We want to have a stable alignment before we do anything. So take a minute and make sure that all of those positioning cues are there for you. You want to be on the back toes. Imagine that the big toe and pinky toe, the weight is evenly distributed so that we're not in pronation or supination, too much internal external rotation. Want to be nice and stable on that back foot. And then this front knee should be knee over ankle. You might feel a slight opening in the front of this hip joint here. The first thing I want you to do is just put your hands on the sides of the lower ribs, wrapping around to the front. And take an inhale and see if you can get any movement out to the sides of the ribs. We always want to be breathing through our nose. If you don't feel any contraction of your abdominals on the exhale, because our abdominals are muscles of exhalation, so when we exhale, we should feel them contracting, you can switch to a s or a sh on the exhale. Make sure you breathe everything out on that exhale. See if one side feels a little bit better or expands out to the side a little better than the other. That's very, very common. I want to make sure that as you're doing this, you might want to do it in front of a mirror. Make sure you're not shrugging your shoulders up on the inhale. So this can be a great assessment just to see where you're at. The idea ultimately is, as I've gone over before, or think of your core as a balloon. We want to be able to fill that balloon on the inhale, both to the front, to the sides, and to the back. So once you've worked on this for a little bit, now we can add the movement. So you're going to bend your elbows at your side. You can advance this eventually. You could use bands and different things. But for now, I want you to just be in your own body. Feel the movement within your own body weight with no external forces, okay? So you're going to inhale, and this right elbow is going to come backwards, and this left arm is going to go forward. As you exhale, you're going to do the opposite. So you should feel some nice contraction through the abdominals. These left ribs are going to come back, and the arms are just moving at the behest of the rib cage. So you might not get very far at first, and that's okay. I want you to note if the shoulders want to shrug up, if the low back wants to arch and extend, then don't go as far. Maybe you can only go this far to begin. But the whole idea is that you want, and then you could switch to the other side and see one side might be easier or harder than the other. So inhale, that elbow comes back. Make sure you breathe out, exhale everything out. The whole idea is that we're trying to gain more movement and coordination through this part of the spine. If you think about what I'm doing, ultimately, it's setting ourselves up for gait. Because as we step forward with this front leg, we should then be rotating away with this side of the rib cage. So starting in this half kneeling position, just you can start kind of coordinating those two sides, working on this movement, but it's a little bit more stable than if you were standing. So this can be a great position to utilize as a warm-up, just like the quadruped drills I've gone over in other videos, or the supine 90-90. You know, all these things, the whole idea is that we're kind of trying to retrain and repattern our brain to move the way it was always meant to be. Frankly, the way we started out moving, and we've moved away from as we've been more sedentary, as we've had repetitive movements, injuries, accidents, stress, etc. So you should feel no discomfort in your low back or your neck. If you do, stop, reset. Maybe look at yourself from the side. Make sure you're not dumping forward here. Make sure the neck's not dumping forward. So this can be a really great check-in and self-assessment as well as a good warm-up. Try it out, give it a go, see how it feels, and let me know. Thanks.